Hi guys, welcome or welcome back to my channel. I hope everyone is doing very well today. So I'm back with another video. Today's video is sort of like a pregnancy update kind of video. So I'm going to tell you guys, I'm going to be sharing with you guys and updating you guys on what's been happening, because a lot has happened and a lot has changed within a few weeks. Well, I don't know what the title of this video is going to be yet, so I don't know if I'm going to be giving anything away from the title, but yes, a lot has changed. The baby has other plans. So if you want to know more about what has changed in my pregnancy, keep watching. Okay guys, don't forget to subscribe if you haven't already. Subscribe and join the family. And also like this video, please, and turn on your notification bell so you get notified whenever I post a new video. Okay, let's get straight into this video. Okay guys, so where do I start from? I don't know if you've seen my hospital bag video. If you haven't, I'm going to be putting a link on the screen so you can go check it out. But basically, I packed my hospital bag based on normal vagina delivery. But like I said, things have changed. You know, you plan, you pack your bags, you do all you have to do, and the baby just being there, just smiling at you, telling you, oh, I have my own plans, mama. Well, that's exactly what my baby told me. Because okay, let me start from my 36 weeks appointment. So I had my 36 weeks appointment with my midwife, and my midwife told me that my baby is breech. I don't know if you know what that means, but I'm just going to briefly tell you. So when they say your baby is breech, that basically means that your baby's head is up instead of down. So the biggest part of the baby is supposed to come out first, which is the head. So the head's supposed to be engaged in the pelvis. But my baby's head is up and the butt and legs are down. So that means my baby is breech. So she said there's still a chance that the baby might turn before 40 weeks, but she's just gonna book me for another scan in the hospital, because I normally have home visit midwife appointment. But she said she's gonna book a scan for me at 37 weeks to see if the baby has turned. So 37 weeks, I've gone for my appointment. They've done the scan, and the baby is still head up. I know. Well, anyways, so he's still breech at 37 weeks. After 37 weeks, he was still breeched, and they actually found out that his butt is not on my pelvis; it's actually his foot. So he's kind of like in a position of an athlete trying to about to run a race. So you know how they position himself when they're about to run. That's how his legs are. So one leg is down my pelvis, and the other leg is on the other side. I know, it is wild. So because of that, so normally when your baby is breeched, there are three things that you can do. You can either they can turn the baby manually, or they can decide to allow you give birth vaginally to a breech baby, or do a C-section. So for my first option to turn the baby, actually let's start from the one that was just a no-no. So the vaginal breech baby delivery was a no-no because it was very risky, because my baby's butt wasn't even down my pelvis, it was his foot. So I was having what they call footling breech, because his foot was down there instead of his butt. So yeah, so that was a no vaginal delivery breech baby in my case. The second one was the manual turning of the baby in my belly. The surgeon said that is an option, but it's a 50-50 chance of the baby actually staying turned, and it's not pain free. So it's quite painful to turn the baby. So I'm thinking to myself, there's a possibility that the baby, after going through all that pain of trying to turn the baby might not actually stay turned. So I've just stressed myself and endured that pain for nothing. So yes, that was the second option. So I said no to that. And then the third option was C-section. A planned C-section, not an emergency one. So it's a little bit of a difference between a planned C-section and an emergency C-section. So a planned C-section is when you plan, obviously, as the name implies, it's planned. So everything is all scheduled. The doctor knows your situation, all your files and all your medical histories. Everyone who's going to be involved knows about it. You have a date, and everything is basically planned. And the surgeon doesn't have to rush. He takes his time, cut you up gently, like a gentle C-section, and just makes sure everything is done without rush. An emergency C-section, on the other hand, is probably happens when maybe you've been trying a vaginal delivery and maybe something went wrong and they have to immediately take the baby out. So everything is in a rush. Everything is rush. The surgeon might not really necessarily know your history, because the surgeon doesn't give birth to babies vaginally. So everything is basically rushed, Your baby needs to come out ASAP. There's a risk of cutting other things in your belly and everything. So basically, what I'm trying to say is, a planned C-section is a lot safer than an emergency C-section. So, and that was the option that I chose. So I am having a C-section. Actually, that's by the time I'm filming this video, my C-section is in 2 days. Wow. Wow. Okay. So, yes, I'm going to be having a C-section in 2 days. Obviously, I'm going to keep you guys updated on everything. I don't know if I'm going to film it. I might film it, but I don't know if I'm going to put that video out, but we'll see. But I'm going to obviously give you guys an update on how everything went, and obviously update you on my recovery and stuff, because obviously C-section recovery is a little bit longer than normal vaginal recovery. But come to think about it, I'm actually a little bit happy. Well, not a little bit. I'm actually a lot happy that I'm having a C-section, because at the back of my mind, I think I have been a little bit wary and worried about having normal vaginal delivery. I don't know, but it's always giving me anxiety. Like, probably because I'm a first-time mom, I've never done this before, but I've always had this little fear. Oh my god, if I'm just tired and I can't push, what's gonna happen and stuff like that. So I think I prefer to take the scar and a little bit longer recovery for a C-section than take the vaginal delivery. So they actually worked out well for me, actually. So that was good. So yes, I'm having a C-section. And because I'm having a C-section, I had to change my hospital bag. So if you've seen my hospital bag video, that is perfect for a vaginal delivery. But because I'm having a C-section delivery, when I come into the hospital, my midwife has told me to come with a small bag and leave every big bag in the car. So just a small baby bag to have all the baby essentials, and a little bit for myself that I'm going to take into the surgery room, into the operation room, and then later on when I go into my postnatal ward, then I can bring in the bigger box. So all the things in the box that I showed you guys in my hospital bag video are still in there. I've just taken out some stuff and put in this baby nappy bag, which I'm going to show you guys now. Just so you guys see the difference between a vaginal delivery hospital bag and a C-section hospital bag. So what I've basically packed in this bag, so I've just taken out this fluffy slippers from my hospital bag and I've put in here, because I'll probably be wearing this when I get to the operation room. And then obviously I took a blanket for the baby, and I also took a robe for myself. My midwife has told me to bring a robe. I don't know, I probably will have to wear this in the operation room, I don't know, but I just took a robe. I have also what's this? Oh, this is my hospital gown. So this, I don't know, in my previous hospital bag video, I told you guys I ordered hospital gown. It didn't come when I was filming that video, but now it's arrived and it's here. So it's just basically a button down gown that opens at the back. So this is the back of the gown. So it opens up at the back, so you can administer any spinal anesthetics or you know, whatever they're going to give me, whatever injection they're going to give me at the back to numb the pain, so I don't feel the pain of the operation. So it can easily wear this and give me through the, I don't know if I'll be able to wear this actually for a C-section, or if I would need to actually wear a hospital gown, but I just took this anyways. And this also has two this also has two openings for breastfeeding, so I took that one as well. And then I have just taken some what's this called now, swaddle blankets, some baby swaddles. So I've taken some baby swaddles there for the baby, and also I've packed some baby vest and baby grows for him as well, and also some a few hats, because the first hat always gets dirty very easy and very quickly. So I think I've taken 2 or 3 hats in this bag, and I've taken the rest in the other bag. So I've just taken these, and also these mittens. Thanks for letting me know what the name of this thing was. So the mittens and another hat. So I have about 3 hats here for the baby, and then obviously I have 1 socks for myself. Just put this back. I have just taken in a few bob cloths, washcloths, and a muslin cloth for him as well. And another thing that I took, I think in my hospital bag, I was actually looking for this cotton wool. I couldn't find it, but I told you guys that I got a cotton wool just in case it reacts to the wipes. So I just put in the cotton wool in the bag. I'm not sure if I'm going to use this immediately, but just in case, I just put it in there. There's space in the bag, so I just put it in there. And then obviously I've packed in his pseudo cream for his rash cream, nappy rash cream, so you can use this when we put his diapers. And speaking about diapers, I've packed in some diapers here, size 1 and size 0, because like I said, I'm not sure of what his size is going to be. So I've just packed some size 0 diapers and size 1 diapers. And then obviously I've put in his wipe, 1 pack of wipe as well for him. So majority of these things I just took it from the other bag, from the other box, from the bigger box, and just put it in here. So just these essentials. And then I'm going to obviously bring the other box in later on, so I can find every other thing that I need in there. But yeah, so this is just what I have packed in here to go into the theater. So that is a quick rundown of all the things that I've packed into this smaller bag I'm going to take into the theater room. It's mainly just baby things, that the things he's going to use immediately he's been born, and a few things that I'm going to need, like slippers and robe, and you know, the stuff. So that's what I've packed in here. I think another thing that I've packed in here is is this maternity disposable pants and pad. So I've just put in 2 there because I'm not sure when I'm going to have to wear this. I don't know if I'm going to wear this after the operation or if I'm going to wear this after they move me to the postnatal ward. But I've just taken this just in case, so I don't get, so I'm not stranded. So I have 2 of this in here. So I have 2 of that in there just in case I need it. I had space there, so why not? And I'm going to also put my phone in there because I still have some pockets here. So I'm going to put my phone in there, charger in there. Have some space on the side and as well on the other side. So I'm going to pack that along with this bag. And then when the other bigger bag comes, more things, and I can use every other thing that I've brought, but they are not immediate. So these are the immediate things that I think I will need based on what I was told in the hospital and what my midwife has told me. So yeah, so that is the only difference between my hospital bag that I've packed before and my hospital bag now. I just split it a little bit, some in the smaller bag and the rest in the bigger box. So yeah, so that's my updates today. I'm now going to have a C-section, which I'm not even mad about. And I just showed you guys changes I've made to my hospital bag. So that's it. Until this time, actually 1.5 days time, I will be meeting my baby. How exciting is that? I'm very excited and I'm a little bit worried. I think now that it's so close now, I'm like, oh my god, did I feel him move today? He normally moves by 12. Did I feel him move by 12? Can't remember. I'm just panicking, I guess. But yeah, everything is going well. Plans changed, but we're moving along, and that's it. So thank you so much for watching this video. If you have any questions, you can always leave them in the comment section and I'll definitely be getting back to you guys. So thanks so much for watching this video and I will see you in my next one. See you guys. Bye.